Welcome. Today we'll be covering different lung sounds, what they indicate, and how to recognize them. As nurses, understanding these sounds is critical for diagnosing and managing respiratory conditions. So let's get started. Vesicular breath sounds are the normal sounds heard over most of the lung fields. They are soft, low-pitched, and heard more on inspiration than expiration. Imagine the sound of rustling leaves as air moves smoothly through the small airways. Crackles, also known as rales, are discontinuous, popping sounds heard more often during inspiration. They can be fine or coarse, resembling the sound of crinkling cellophane or bubbling water. These sounds are often associated with conditions like pneumonia, heart failure, and pulmonary fibrosis. Wheezes are high-pitched, musical sounds that occur when air passes through narrowed airways, commonly in conditions like asthma or COPD. They are typically heard more during expiration, but can occur during inspiration as well. Rhonchi are low-pitched, snoring or gurgling sounds caused by fluid or mucus in the larger airways. They often clear with coughing and are commonly associated with bronchitis and chronic obstructive pulmonary disease. Stridor is a harsh, high-pitched sound heard during inspiration. It indicates upper airway obstruction such as croup, epiglottitis, or a foreign body. A pleural friction rub sounds like two pieces of leather rubbing together. It is caused by inflamed pleural surfaces rubbing against each other, often due to pleuritis or pericarditis. Recognizing lung sounds is an essential skill for healthcare providers. By understanding the differences between normal and abnormal breath sounds, we can better assess and manage respiratory conditions. Keep practicing and remember to correlate these findings with your patient's symptoms and history. Thanks for watching.